Faduma is 18 months old and has been brought to the clinic because she is sick and has an itching rash. This is her first visit to the clinic for this problem. Her temperature is 37 degrees and she weighs 6 kilograms. First, check for general danger signs. The mother says that Faduma is able to drink, is not vomiting, and has not had convulsions. Look to see if Faduma is lethargic or unconscious. Write down your assessment. Does Faduma have any of the general danger signs? Now, assess Faduma for the first main symptom of cough or difficult breathing.
Does the child have cough or difficult breathing?
The mother replies that Faduma has had a cough for 7 days. Count the number of breaths Faduma takes in 1 minute. Prepare to start counting. Start counting now. Stop counting. Write down the number of breaths you counted and decide whether Faduma has fast breathing. Now look for chest in drawing. Write down whether chest in drawing is present. Now, look and listen for stridor. Look and listen now. Write down your assessment. That completes the assessment process for a child with cough or difficult breathing. You should now use the signs to classify the illness. Ask about the next main symptom.
Does the child have diarrhea?
Faduma has had diarrhea.
For how long?
The mother replies, 6 days.
Is there blood in the stool?
There is no blood in the stool. Now write down your assessment of the signs of dehydration. Look at the general condition of the child. You have already assessed whether Faduma is lethargic or unconscious when assessing for general danger signs. Now assess whether the child is restless and irritable. What have you decided? Look for sunken eyes. Write down what you decide. Would you say that Faduma is not able to drink or drinking poorly? Would you say she was drinking eagerly and thirsty? Or does she drink normally? Write down what you decide. Pinch the skin of the abdomen. Does it go back very slowly, taking longer than 2 seconds? Or slowly? Or immediately? Write down your decision. You should now use the information to classify Faduma's diarrhea. Ask about the next main symptom.
Does the child have fever?
Faduma does not have a fever. Ask about the next main symptom.
Does the child have an ear problem?
The mother says, yes.
Is there ear pain?
The mother says, no.
Is there ear discharge?
The mother says there has been ear discharge for 3 weeks. Look for pus draining from the ear. Is there pus draining from either of Faduma's ears? Feel for tender swelling behind the ear. There is none. You should now classify Faduma's ear problem. Check for malnutrition and anemia. Look for visible severe wasting. Look for palmar pallor. Does Faduma have severe palmar pallor? Or some palmar pallor? Or no pallor? Look for edema of both feet. The health worker determines Faduma's weight for age. Faduma is very low weight for age. You should now classify Faduma's nutritional status. Finally, the health worker checks Faduma's immunization status. She has completed her immunizations. Later, you will learn to assess the child's feeding. Now assess any other problems. Faduma's mother reported a rash which itches. What is your assessment of this rash? That completes Faduma's assessment. Choose the appropriate classification for Faduma and write it down. We will now tell you our assessment and how we classified Faduma's illness. Faduma is aged 18 months. Her mother told us she brought Faduma to the clinic because she is unwell and has an itching rash. First, we checked Faduma for general danger signs. Faduma was able to drink. She was not vomiting and did not have convulsions. Faduma was not lethargic or unconscious. Faduma does not have any general danger sign. What did you decide? Next, Faduma was assessed for the main symptom cough or difficult breathing. Faduma has been coughing for 7 days. We counted 43 breaths in 1 minute. Therefore, at 18 months old, Faduma does have fast breathing. We saw no chest indrawing. We could hear no harsh sound as Faduma breathed in. Therefore, we decided Faduma does not have stridor. Faduma has no chest indrawing, no stridor, and no general danger signs. First, look at the signs listed in the pink row. Faduma does not have signs of severe pneumonia or very severe disease. So we look at the next row down. Her sign of fast breathing puts her in the yellow row. Therefore, we classified Faduma as having pneumonia. We moved on to ask about diarrhoea. Faduma has had diarrhoea for 6 days and has no blood in the stool. We looked at the child's general condition and decided that Faduma was not lethargic or restless and irritable. We looked at Faduma's eyes and decided that the eyes were sunken. When offered a drink, Faduma drank normally. When Faduma's skin was pinched, the skin went back very slowly, taking longer than 2 seconds. Look at the pink row. Faduma has the signs of sunken eyes and skin pinch goes back very slowly. We therefore classified Faduma as having diarrhoea with severe dehydration. As Faduma has had diarrhoea lasting less than 14 days, she is not classified as persistent diarrhoea. As there was no blood in Faduma's stools, we decided that she does not have dysentery. We would therefore classify Faduma as diarrhoea with severe dehydration. Faduma does not have fever. She does have an ear problem. Faduma has no ear pain, but pus has been draining from one ear for 3 weeks. Pus is draining from her left ear. There is no tender swelling behind her ears. Faduma does not have mastoiditis. Pus draining from the ear and discharge reported for 14 days or more is a chronic ear infection. We would therefore classify Faduma as chronic ear infection. We then checked for malnutrition and anemia. We decided that Faduma does have visible severe wasting. Faduma also has some palmar pallor. Faduma does not have edema of both feet. Faduma is very low weight for age. Faduma's sign of visible severe wasting places her in the pink row, severe malnutrition or severe anemia. The child also has a rash which itches. This is not a measles rash. The measles rash does not itch and does not look like this. Measles rash also occurs with fever. We therefore classified Faduma as pneumonia, diarrhoea with severe dehydration, chronic ear infection, and severe malnutrition.